Are you ready for the big daddy? Vancomycin is the biggest daddy. He got his own page. Damn. All right. So vancomycin is in a drug class called glycopeptides. Vancomycin, glycopeptides. All right. MOA inhibits cell wall synthesis. So what? All right. Drug of choice for the big daddy bacterias. What are big daddy bacterias? C. diff, right? MRSA, okay? And endocarditis, that'll kill you. Endocarditis, big, bad heart infection. So Vanc is a heavy hitter. He is Big Daddy. Got it? He's nephro-oto, right? Because if something is nephro, it's going to be oto. So you already know what to do. BUN, creatinine, GFR. Make sure you hydrate that patient. Flush out those kidneys, right? Report tinnitus, okay? And then after they finish vancomycin, we're going to send them to audiology 6 months after they complete the treatment to make sure that the hearing loss is not permanent. Okay. All right. Vancomycin is vanc is a vesicant. What do we say a vesicant was? It burns the inside of the vessel, causing thrombophlebitis. How do you know they have thrombophlebitis? What's your keywords?
It's hard like a
palpable, which means touchable, palpable cord-like vein. What do you do if a patient gets thrombophlebitis?
You're gonna take it out.
Take out the IV, warm compress, start the IV at a different site. We know if a drug is a vesicant, we have to give it very slowly. Okay. All right. It also, vancomycin has a narrow therapeutic index. We have to draw a peak and trough. We're going to draw the peak after the fourth dose, and you're going to draw the trough right before the 5th dose. Okay. All right. Big important for vancomycin is to watch the skin. There are 3 big, huge, horrible skin things that can happen, and you need to know which ones are happening and how to treat it. So we've got the cause, the signs and symptoms, and the nursing care for each. Okay. So when you are taking vancomycin, one of the biggest things you need to know about this drug is it can cause what's called red man syndrome. They're probably going to change the name because say it's racist or something.
I saw redneck syndrome. Is that the same thing?
Redneck?
Yeah,
Redneck syndrome.
Redneck or redhead syndrome.
Well, it's the same thing. They're probably trying to change it from red man because it hurt somebody's feelings. You know what I mean? But then redneck kind of would hurt someone's feelings too. You don't want them redneck boys coming after you, okay? All right. So red man syndrome. Red man syndrome will cause hypotension. The patient's going to start severely puking and they flush from here up.
Okay.
This happens because you gave it too fast. Now, most antibiotics, when you're giving them IV, you can give them over 30 minutes. Vanc is an exception. It has to be given over at least 60 minutes. So what would happen if you started Vanc, you went to go assess your patient 10 minutes after starting it. They start puking. They're red from here up. What are you going to do? First thing you do, stop the Vanc. Then what?
Give them.
Be like, I'm sorry. Yes, it's your freaking fault because you gave it too fast. So you can either stop or slow down the infusion. Be like, I'm sorry. I mean, obviously I'm going to set them up because they're pukey puke, right? And I can either give them a little bit of antihistamines, which function as an antiemetic. Did y'all know that? Antihistamines can help you with throwing up because they dry you out a little bit. Okay. Like diphenhydramine, Benadryl, we use it as an antiemetic, right? Because y'all know antihistamines dry you out, right? Yeah. Okay. Now you're going to report red man syndrome. No, it's your fault. You fix it.
Yeah.
Your fault. You fix it. Okay. Now, unless the patient has severe hypotension to where you need to give them a bolus and you're going to have to call the doctor and be like, oh, sorry. Can I get a bolus? This patient's blood pressure is 80/40. I'm so sorry. Okay. But red man syndrome is whose fault? Yours. You should give Vanc slowly. Give
Vanc slowly.
What?
Over 60 minutes.
Good. All right. The next thing that can happen, obvi, is anaphylaxis. Lots of people are allergic to Vanc. Y'all should know what's going to happen, right? Pruritus, hypotension, urticaria, wheezing. First thing you do when someone's having an allergic reaction to a drug, stop the drug. Okay. And then we're going to give them a massive fluid bolus because their blood pressure is probably, 40/1. All right. And then we're going to give epi if it's a severe reaction. Epi-IM. And then diphenhydramine. What's diphenhydramine? Benadryl. That's an antihistamine. And then albuterol if they're wheezing. Yes, that's a bronchodilator, right? All right. We know that one. That one should be easy. The last skin thing you have to look for is SJS. Now I'm going to stop here and I'm going to show you SJS because we're going to have this a lot in this course. SJS stands for Steven Johnson syndrome. Sounds like your neighbor or something. Oh yeah, my neighbor Steven Johnson, Steven Johnson can be horribly life-threatening it is a hypersensitivity reaction, okay? Which a hypersensitivity reaction basically means like, well, y'all tell me what it means. What does a hypersensitivity reaction mean to you?
That's like allergies. No, like
Yeah, like a
when you're-
massive, like some kind of allergic reaction. Like your body is like hypersensitive to whatever this is, which happens to be
Like
vanc.
I'm like cats.
Like, oh, oh, really?
I'm really
Allergic to cats?
cats.
So in Stevens-Johnson syndrome, this patient will burn from the outside in and from the inside out.
Is that when their body starts
Their
sloughing
whole
off?
body sloughs off, and all of the outside of their organs also sloughs off. It's so bad. We send this patient to Burns ICU and treat them like a burn patient because their entire skin's going to come off.
Actually,
Now,
I
I'm going to
see
show
this.
you a mild one, and then we'll show you a severe one. Okay, this is mild.
Yeah.
Okay, that's a mild Stevens-Johnson syndrome. Okay, but when they get too severe, when we have to send them to Burns,
That's fine.
brace yourself if your
I already
stomach.
seen it.
Okay, yeah, all of their skin just comes off. Okay, and this is happening inside their body as well. All of the organs are sloughing off. It can be life-threatening. It is very, very bad. Do you understand? Okay. So in Stevens-Johnson syndrome, it may start out as papules and vesicles. What's a papule? It's a
like
raised lesion.
raised
That's all it
lesion.
means, is that it's raised. What's a vesicle?
It's like a notch. Is it like a notch? No.
Like a blister?
Fluid filled.
Fluid.
A vesicle means that it's fluid filled. So you'll get these fluid filled lesions and these raised lesions. They'll get purpura. What's purpura?
That's
The big purple spots under their
purple spots,
skin.
yeah.
Yes. They'll start getting crusty lips. I showed y'all a picture of that. And all their mucous membranes. They may have fever, sore throat, be very tired, conjunctivitis where their eyes turn red because their eyes are starting to slough off. And then it's just going to progress from there. So we treat this patient like a burn patient, and it may progress very quickly to shock mod's death because it's a burn patient. They lost all their fluid.
Yeah.
Okay. So you understand the 3 things you need to look for on the skin for a vanc patient. All right. So big important things about vanc. Vanc is a vesicant. It works. That's a big daddy. It works on big daddy bacterias like C. diff, MRSA, endocarditis. It's nephro-oto, right? And then we need to watch for tinnitus and the skin. Red man syndrome. Whose fault? Because how long are you supposed to give vanc over? At least 60 minutes. Anaphylaxis is a big deal. SJS is a big deal, right? What's the first thing you do for red man syndrome or anaphylaxis? Stop the medicine, assess, figure out what you need to do, and then move on. We got vanc? Okay.